Addiction. It's a word often uttered in hushed tones, laden with judgment and misunderstanding. But at its core, addiction is a chronic, relapsing disease. It's characterized by compulsive engagement in rewarding stimuli, despite adverse consequences. Imagine a powerful force taking hold, hijacking the brain's reward system. The individual, once in control, now finds themselves caught in a relentless cycle of craving and use. Addiction knows no boundaries. It doesn't discriminate, affecting people of all ages, backgrounds, and walks of life. It's not a sign of weakness or a lack of willpower. Rather, it's a complex interplay of biological, psychological, and social factors. The grip of addiction is relentless, affecting not just the individual, but also rippling outwards to touch the lives of their loved ones. Relationships become strained, careers falter, and hope dwindles. The individual may experience intense feelings of shame, guilt, and isolation, further fueling the cycle of addiction. Breaking free from addiction's clutches is a formidable challenge, but one that is surmountable with the right support and understanding. It requires acknowledging the problem, seeking professional help, and embarking on a journey of recovery. Addiction manifests in various forms, often categorized as either substance use disorders or behavioral addictions. While the objects of addiction may differ, the underlying neural mechanisms share striking similarities. Both involve the same reward pathways in the brain, leading to compulsive behaviors and significant impairment in an individual's life. Substance use disorders involve the misuse of alcohol or drugs, leading to intoxication and alterations in brain chemistry. Alcohol, opioids, stimulants, and cannabis are just a few examples of substances that can lead to addiction. These substances hijack the brain's reward system, flooding it with dopamine and creating a sense of euphoria that the individual craves again and again. Behavioral addictions, on the other hand, involve compulsive engagement in activities despite negative consequences. Gambling, gaming, internet use, shopping, and even sex can become addictive behaviors. Just like substance use, these activities trigger the release of dopamine in the brain, reinforcing the behavior and making it increasingly difficult to stop. Whether it's the allure of a substance or the thrill of an activity, addiction ultimately stems from a deep-seated need for relief, escape, or comfort. Understanding the different forms addiction can take is crucial in providing appropriate and effective treatment. Addiction is a multifaceted condition with a complex web of contributing factors. While the exact causes may vary from person to person, a combination of genetic, psychological, and environmental factors plays a significant role. Genetic predisposition can increase an individual's susceptibility to addiction. Research suggests that certain genes may influence how the brain responds to drugs or addictive behaviors. For example, individuals with a family history of alcoholism may be more likely to develop alcohol use disorder themselves. Psychological factors, such as trauma, abuse, mental health disorders, and personality traits, can also contribute to addiction. Those who have experienced significant trauma or abuse may turn to substances or addictive behaviors as a way to cope with emotional pain, stress, or difficult memories. Environmental factors, including social influences, cultural norms, and access to substances or addictive activities, also play a crucial role. Peer pressure, exposure to substance use at a young age, and living in an environment where addiction is prevalent can all increase the risk of developing an addiction. It's essential to remember that addiction is not a choice. It's a complex interplay of factors that can hijack the brain and lead to compulsive behaviors. By understanding the roots of addiction, we can foster greater compassion and develop more effective prevention and treatment strategies. Breaking free from the clutches of addiction is a challenging but achievable goal. The journey to recovery is often long and winding, marked by setbacks and triumphs. It requires immense courage, resilience, and a steadfast belief in the possibility of change. Fortunately, a wide range of treatment options are available to support individuals on their path to recovery. Detoxification is often the first step in addressing substance use disorders. This process involves safely managing withdrawal symptoms as the body clears itself of the addictive substance. Medications may be used to alleviate discomfort and reduce cravings during this crucial stage. Therapy plays a vital role in addressing the underlying causes of addiction and developing coping mechanisms. Cognitive behavioral therapy, for instance, helps individuals identify and change negative thought patterns and behaviors associated with addiction. Support groups, such as Alcoholics Anonymous or Narcotics Anonymous, provide a safe and supportive environment for individuals in recovery to connect, share their experiences, and offer encouragement to one another. These groups foster a sense of community and belonging, reminding individuals that they are not alone in their struggles. Medications can also be an effective tool in managing cravings and preventing relapse. Medications like methadone or buprenorphine are used to treat opioid addiction, while medications like acamprosate or naltrexone can aid in alcohol addiction recovery. Recovery from addiction is not a destination, but an ongoing process. It's about progress, not perfection, and setbacks are a normal part of the journey. With the right support, individuals can overcome addiction, reclaim their lives, and experience the profound joy of lasting recovery.